Right. So today we're gonna dive into some pretty intense stuff. The U.S. healthcare system,
Yeah, the
and
big one.
yeah, exactly. It's a massive topic. And I think to say it's just a hot button issue is kind of underselling it a little bit.
Yeah, I think that's fair.
But that being said, we're gonna try to unpack some of the complexities, the ethical dilemmas, all that kind of stuff.
Right. Looking at how profit kind of intersects with patient care and how technology plays into all of that
Exactly.
in a system that, frankly, even the people who use it and rely on it, you know, criticize quite a bit.
Yeah, and our source material for this deep dive, it starts with a pretty wild story. The assassination of Brian Thompson,
Hmm.
the CEO of UnitedHealthcare,
Yeah.
on his way to an investor meeting, no less.
Yeah. And I mean, I think the setting itself, right? A fancy Manhattan hotel.
Oh, yeah.
And the method he was killed with a 3D printed gun with bullets that were inscribed with deny, defend, depose.
Oh, wow.
It really highlights the tension around this case.
It's almost like, it wasn't just an assassination.
It's symbolic.
It was symbolic, exactly. It was like a statement. It was a protest almost against this system that, he clearly felt was broken.
Yeah, and I think to get to, the heart of what's broken about it, we have to sort of understand where the assassin is coming from.
Yeah.
So he calls the U.S. healthcare system legalized fraud,
Jeez.
arguing that insurance companies really put profit above the well-being of patients.
It's a powerful accusation for sure.
It is. And he sees this investor meeting that Thompson was going to as an example of that focus on financial gain rather than on human life.
And it is interesting because he's kind of pointing at this system where people are struggling to afford care, even when they have insurance, which is supposed to help with that, theoretically.
It's supposed to mitigate that. And yet so many Americans are paying really high monthly premiums,
Yeah.
but then getting hit with these massive out-of-pocket costs
Yeah.
before their insurance actually covers anything.
It's like you're paying for the insurance, but then you still have to pay like a ton of money before it's even useful.
Exactly. Those out-of-pocket costs are what we call deductibles here in the U.S. system.
Yeah.
So you can imagine paying, hundreds, even thousands of dollars
Wow.
before your insurance kicks in.
Yeah.
And for a lot of Americans, those deductibles are so high that they just can't afford the care they need,
Yeah.
even though they're paying for insurance.
And they're insured on paper.
Exactly.
Right.
It really does leave people feeling trapped and vulnerable, especially when they're, facing a serious health issue.
And then the assassin's argument goes even further, claiming that UnitedHealthCare, Thompson's company, was using artificial intelligence, AI, to basically perpetuate this legalized fraud, as he calls it.
Yeah. AI in healthcare, I mean, it's not inherently bad.
No, not at all.
There's potential for it to do a lot of good, speeding up diagnoses,
Yeah.
Streamlining processes, things like that.
Yeah.
But the way it's being used here, it definitely raises some red flags.
Yeah, some big questions.
Yeah.
For sure. So the assassins alleging that they're using AI to basically automate denials of coverage,
Right.
Essentially making, life or death decisions based on an algorithm, which is
Yeah.
pretty scary when you think about it.
I mean, there was a congressional investigation into this, and they actually found evidence
Wow.
that this was happening. A 15% increase in denied treatments
Wow.
after they implemented this AI system.
That's pretty damning.
It is. And the people who were most affected by these denials were elderly patients
Oh gosh.
needing critical care.
Yeah, it's a tough example to swallow, Like technology on its own, it's
Wow.
not, inherently good or bad, but it's how it's applied and
who's using it.
who's using it and for what purpose.
Right. Absolutely. And the assassin sees this as a direct result of the power that corporations have in the U.S. healthcare system.
Yeah.
He claims they're using their money to shape legislation through lobbying.
Yeah.
So essentially using money to influence politicians and get laws passed that benefit their bottom line.
So he's saying that they're putting profits ahead of patients, basically.
Right. Using their power to manipulate the system for their own gain.
Yeah.
It's a big accusation.
Yeah, it's a big one, and it definitely raises some questions about, accountability,
Transparency.
transparency, like how much influence do these corporations have, you know.
Right. And not just in healthcare. We see it in other essential services.
Yeah.
How much power is too much power?
Yeah.
And how do we make sure that people's needs are being met
Right.
rather than, the pursuit of profit above all else?
Yeah. It's a tough question for sure.
For sure.
It's almost like a tangled web, right? You've got these corporations and the profits and the patients, and it's hard to even see where one ends and the other begins.
Totally.
But the assassin goes even further and argues that the U.S. government has basically abdicated its responsibility to the people
Right.
by letting healthcare become such a profit-driven enterprise.
He sees it as, a government's primary role should be, ensuring security
Right.
and health and education for its people.
Yeah.
And when those things become industries that are just driven by profit, he sees that as a real fundamental betrayal
Yeah.
of that responsibility.
He uses this term "sick market"
Yeah.
to describe this whole thing, like, where the pursuit of profit is actually coming at the expense of human well-being, which is, I mean,
It's a bleak picture for sure.
it's a pretty stark way to put it. But it does kind of force us to ask, I mean, are there other ways to do this? Are there alternative models out there that could address these issues?
Yeah, there are definitely other ways to approach healthcare.
Okay.
Many countries around the world have systems that put universal access and affordability
Okay.
first and foremost.
So, like, you hear people talk about, like, the Scandinavian model.
Right, exactly.
Right.
Often held up as an example of a system where, healthcare is treated as a right, not
Right.
a privilege,
Right.
as it seems to be here.
So how does that actually work, in practice? Like, how does a system like that
Right.
play out compared to what we're used to?
So in a universal system, everyone is covered,
Okay.
regardless of, their income,
Okay.
employment status, anything like that. Funding comes from taxes,
Okay.
and the government plays a big role in ensuring that it stays
Right.
high quality and affordable.
So you're saying there's no deductibles or like people aren't being denied coverage or any of that
Yeah.
kind of stuff.
You can get the care you need when you need it.
It sounds like a much simpler
Yeah.
and sort of humane
Streamlined.
approach. But I imagine there's got to be some downsides, right? I mean, no system's perfect.
Sure, yeah.
Oh.
I mean, no system is perfect.
Right.
You hear debates about wait times and government bureaucracy,
Mm-hmm.
the cost to taxpayers, things like that.
Right.
But, the fundamental principle is that healthcare is a basic human right. It's not something to be bought and sold
Yeah.
in the market.
It's like a totally
A
different
philosophical difference.
Yeah.
And I think that's what the assassin's actions, as extreme as they were,
Right.
really highlight that contract.
And it's not just a difference in philosophy. It's about how these things actually play out in real life.
In people's lives.
Yeah.
I mean, the U.S. system with its, potential for these denials of coverage, these high costs,
Right.
it can create huge stress
Yeah.
and hardship for families and individuals.
We've talked about the denials and the deductibles and
Yeah.
and the financial strain, all that. But let's flip that coin over for a second.
Okay.
Talk about the profits. These insurance companies are making billions every year.
Every year. I mean, just to give you a sense of scale here, Humana brought in over $106 billion.
Wow.
Cigna, $195 billion.
Mm.
CVS Health, a staggering $357 billion.
Wow.
Alliance, $157 billion. And UnitedHealthCare, they're actually leading the pack with $371 billion in revenue.
That's an insane amount of money.
It's a lot of money.
Yeah. So it's natural to ask, are these profits actually justified when you weigh them against all the struggles that so many patients are facing?
I mean, it makes you wonder, where's all that money going? Is it going back into improving care, lowering costs, expanding access?
Right.
Or is it going to, shareholders and executives?
It's a big question for sure.
It's a question that deserves some real scrutiny.
Yeah.
We need more transparency when it comes to something as essential as healthcare. People need to understand how it works, where their money's going, and who's benefiting from it.
I think it's fair to say that the assassin's actions criminal as they were, they've exposed some deep cracks in the very foundation of the U.S. healthcare system.
Absolutely.
And his arguments, extreme as they are, I think they force us to kind of confront some uncomfortable truths about the role of profit, the influence of these corporations.
What healthcare even means.
Yeah. What it even means.
Right.
I mean, at its core.
At its core. Yeah. And it's a conversation that needs to happen.
We can't just ignore these issues, and just dismiss this guy as some raving lunatic.
Right.
We need to talk about these things. We need to explore other options, and really demand a system that prioritizes people's health and well-being.
That puts people first. Yeah.
Yeah, it's not just an American problem, though, right? I mean, healthcare systems all over the world, they're dealing with a lot of the same.
Totally. I mean, everywhere you look, costs are going up.
Right.
Populations are aging. We've got all this new medical technology, which is great, but it puts a strain on these systems all around the globe.
Yeah. So it's like we're at this crossroads. This assassination, as awful as it was, it really has kind of like shed light on some of these deeper issues, with how we approach healthcare in the first place. It's like it's a wake-up call, It's like, what are our priorities here? What kind of system do we actually want, for the future?
And that's what's so fascinating to me about this whole case.
Yeah.
It's not just about, the specifics of the U.S. system.
Right.
It's about these bigger questions, these philosophical questions, right? Like, what's the point of healthcare? Yeah. Who should benefit from it? How do we balance the needs of the individual with the needs of society as a whole?
Right. And we've spent this deep dive kind of exploring those questions, right?
Yeah.
I mean, this assassin, he clearly felt very strongly that this profit-driven system was
dangerous.
Yeah. And we've looked at these other models, these alternative models like universal healthcare, that try to put access and affordability first.
Right. And they have their own challenges.
Yeah.
They're not perfect.
Yeah, no system is.
But it's interesting to look at,
to compare and contrast.
Because there's no easy answers here.
Absolutely not. I mean, each model has its pluses and minuses,
Right.
And what works best probably depends a lot on, the specific context of a country, of a region.
But just having the conversation in the first place,
it's huge.
Yeah, that's huge. I mean, we got to be talking about these things, weighing the options, thinking critically about what the future of healthcare should look like.
And this isn't just about, policymakers and experts. Yeah. This is a conversation that everyone needs to be a part of.
Yeah.
I mean, this affects all of us. So as we wrap up this deep dive, I want to leave you with a few things to think about, Like if you could design your ideal healthcare system, what would that look like? What would be most important to you? Would it be access? Would it be affordability? Would it be quality of care? Innovation, and what role do you think the government should play? What about these big corporations or even individuals? What role do we all have to play in shaping that system?
Yeah. These are tough questions.
Yeah.
With no easy answers. But I think, the more we talk about it, the more we think about it, the better equipped we are to actually make some positive change.
Yeah. Thanks for joining us on this deep dive.
Yeah, thanks for having me.
It's been heavy.
It has.
But I think important.
I think so too.
And we hope you'll keep thinking about these things, keep talking about them, and add your voice to this really important conversation. And we'll see you next time.